80 to 90% of lung cancer cases are caused by smoking. There are at least 60 substances in tobacco that cause cancer. Your chance of developing lung cancer increases with the amount of time you smoke and the number of packs you consume each day. Lung cancer risk increases with secondhand smoke inhalation. Additional signs of lung cancer include neck and facial swelling, weakness or exhaustion, clubbing of fingers, recurrent episodes of pneumonia or bronchitis, shortness of breath, coughing or hoarseness, and chronic chest, arm, or shoulder pain. There are no symptoms in the early stages of lung cancer. The likelihood of a favorable result increases with the early detection of lung cancer. Seeing your doctor is crucial if you have an unresponsive cough, a cough that discharges blood, breathlessness, wheezing or hoarseness, neck and face swelling as well as chest pain. Lung cancer is a quiet killer that frequently remains undiscovered until it's well along. The battle against this fatal illness depends heavily on early detection. However, early signs can be slight or easily mistaken for less severe illnesses. Seeking a comprehensive assessment from a healthcare expert is crucial if you have a history of smoking or currently smoke, as these symptoms can be quite concerning. These are the top 7 lung cancer warning signs that you shouldn't ignore. Number 1 is continuous cough. Never write off a persistent cough, even if it is dry or produces mucus. If you have a persistent, worsening chronic cough, get medical attention right away. A cough that is brought on by a cold or lung infection should go away in a week or two, but lung cancer may be indicated by a persistent and recurrent respiratory illness, such as pneumonia or bronchitis. If your cough changes, pay attention to them, especially if you smoke or are exposed to other harmful substances. If you or a family member or friend is coughing up bloody mucus or unusually large amounts of mucus, get medical help right away. Additionally, be mindful of any modifications in your coughing pattern, such as if it has deepened, grown more persistent, or sounded hoarse. Although a simple cold may be the only cause of hoarseness, a cough lasting more than 2 weeks may indicate lung cancer. When a tumor brought on by lung cancer damages the nerve that regulates your larynx or voice box, it can cause hoarseness. 2. Breathing issues and wheezing. When your airways become clogged, narrowed, or irritated, you will wheeze or whistle when you breathe. Wheezing can be brought on by a variety of causes, some of which, like allergies or asthma, are benign and readily treated. Wheezing, however, may also be a sign of lung cancer, so rather than ignoring it, have your doctor look into it. While it's normal to feel out of breath and gasping while exercising or jogging, if you discover that you are easily winded or short of breath after climbing stairs or doing tasks you used to find simple, don't disregard this potential lung cancer sign. Breathing abnormalities may occur if a lung tumor narrows or closes an airway, or if fluid from the tumor accumulates in your chest. 3. Pain in the chest. Lung cancer may be the cause of pain in the chest, shoulders, and back that gets worse when you laugh, cough, or take deep breaths. If you notice any kind of chest pain, schedule a visit with your physician. Make a note of whether the pain is subtle or intense, ongoing or sporadic. Additionally, keep an eye on whether the pain when you cough is localized to one spot in your chest, or if it travels throughout your upper body. Your chest pain could be the result of swollen lymph nodes if lung cancer is the source of your discomfort. The ribs, the pleura protecting the lungs, or the chest wall could also be affected by the metastasis causing the pain. 4. Pain in the back. Back discomfort is somewhat frequent and can be caused by a variety of conditions, such as osteoporosis, strained muscles or ligaments, arthritis, and injuries. Although not everyone with lung cancer has back pain, and many people with back pain are not suffering from lung cancer, back pain does appear to be one of the signs of lung cancer in certain people. One of the earliest signs of the disease may be back discomfort from tumor pressure in the lungs, but it can also indicate that the cancer has migrated to your hips, ribs, or spine and is compressing your spinal cord. This may result in neurologic degradation, which can cause numbness and weakness in the legs and arms, disruption of the blood flow to the spinal cord, and incontinence in the urine and bowel. 5. Exhaustion and loss of weight. You may want to see your doctor find out why you lost 10 pounds if you didn't follow a ketogenic diet. Cut back on sugar and carbohydrates, drink more tea or coffee, or work out every day of the week. Any involuntary and unexplained weight loss could be linked to lung cancer or another dangerous illness. If cancer is the cause, the weight loss could be the result of cancer cells absorbing your body's nutrients and energy. There's a chance that your body's inadvertent weight loss is due to altered energy utilization for eating. In addition to becoming lighter and thinner, cachexia, a metabolic alteration brought on by the cancer itself, may lead you to lose your appetite. 6. Damage to nerves. The symptoms and signs of Horner syndrome are linked to nerve injury. A disruption of the nerve system from the brain to the face and eye on one side of the face can result from facial nerve injury caused by tumors at the top of the lungs. One eyelid may droop as a result, your pupil may get smaller, or you may stop perspiring altogether on the affected side of your face. Numbness or weakness in the arms and legs may result from a big tumor pressing on a nerve. The face, neck, upper chest, and arms may expand if a tumor presses against the main vein that carries blood from the heart to the head and arms. 7. Headaches and bone pain. Pay close attention to all of your aches and pains, as they could indicate lung cancer. If the disease has progressed to your bones, you might feel unbearable agony in your neck, shoulders, arms, and ribs in addition to your vertebrae. It could be challenging to distinguish between bone or muscular discomfort, but if you're sleeping on your back at night, you should anticipate that the pain will get worse. Additionally, any movement may make the pain worse. Constipation, a loss of attentiveness, and fractures are further symptoms. On the other side, headaches could indicate that your brain has been affected by lung cancer. The superior vena cava, SVC, a sizable vein that carries blood from the upper body to the heart, may become compressed by a lung tumor, even though this is not always the case. Pressure on the superior vena cava can result in headaches, migraines, double or impaired vision, convulsions, and speech difficulties. Patients frequently avoid screening because they believe that, in the unlikely event that they have cancer, the side effects of treatment will outweigh the illness. That is just untrue. Treatment can extend life and, more crucially, can reduce symptoms even in cases when lung cancer is diagnosed late and a cure seems improbable. The earlier any cancer is detected, the greater the chance of a successful outcome. Lung cancer can be prevented before it develops. Lung cancer takes 20-30 years to manifest. However, the risk increases with each cigarette you smoke, beginning with the first one. It is far more effective to prevent lung cancer than to detect or treat it. We could reduce lung cancer by 90% if everyone quit smoking. It's never too late to stop smoking. Consult your physician about the available treatments for nicotine addiction. For more insightful videos such as this, kindly subscribe to this channel, like, and share with your friends and loved ones. Thank you for watching.